home care genre. So, Kendall, take it away.
Morning.
Morning.
I'm excited to be here on this side. I've been to the view London continents on I'm glad to finally get up here instead of sitting like, ooh, one day. So today's said day. Does anybody identify as the caregiver? You know what? That is the only thing on my performance review every year that I don't talk loud enough. If you were one of my kids, you'd hear me across the house and in the basement. I'm gonna get better. Does anybody identify as a caregiver? Current, past, or present? Same. Same. I'm here about my pilot, and I'm looking for feedback, and at the end I'll ask you to help me pick a tagline because I'm stuck on it, and my analysis paralysis is a thing. So hopefully I'm looking for a fresh perspective, new eyes, because I feel like I've been looking at it for too long, and then I sink into my thoughts. So I'm looking forward to you all's information, connections information, all that good stuff. Okay. Darn it, you didn't tell me it started already. Shoot.
You're good, just keep
I
going.
even bought my own timer to keep myself on cue. All right, so I'm Kendall. I am a lot of things to a lot of people, but for everybody on that screen, I am responsible for their care, past, current, or future. I am an avid learner, voracious reader, and what that looks like is I've collected a bunch of degrees and a whole bunch of professional certifications. My friends and peers call me a solutionist because I love tackling problems and finding things. I'm an author, a podcast host, a nonprofit founder, consultant, and my 9 to 5, I've served in various capacities and things all around fixing systems, creating solutions, and doing things that help teams, people, and others get better because those things I'm passionate about, and leaving things better than I found them is truly my purpose. So this is my why. The pictures on the left were me and my siblings. I am the only remote worker. Everybody else has at least hour drive. We live in Indiana, my dad was in Illinois, they work in Illinois, so guess who's responsible for doing it? I'm also the self-designated and responsible person in my family. Those were our last pictures we took with my dad a couple weeks before he was rushed to the hospital and never came back home. He spent his last 10 months in 3 facilities, and during the week of Christmas, I got sick, my house got sick, we all got the flu, so I wasn't gonna go see my dad. Prior to that, I've been there at least 5-6 days a week, whole shifts, working bedside, managing his care, doing everything else. When I couldn't go, I was asking friends, family, even his neighbors to go in my place because I know the importance of somebody being there, being present and advocating. While I was out, he caught an infection and it took them over a week to find. The results of that, he lost his mobility, speech, and he just continued to decline until he transitioned. And in that, I found while I was out, there's only so many times you can call people and ask for favors before the guilt of asking is almost equal as the guilt of not being able to show up. So that is how my mind started working, and the solutionist in me, it was like something needs to be different. Those 10 months, I walked the halls up and down. I would wave to people coming by, and I see them, and I learned from the staff, nobody really came to see them. Nobody was checking on them. They looked forward to my wave because sometimes outside of staff, that was all the interaction they could get. But my why came from my experience, not just my dad, but my grandfathers and my aunt's caregiver. When we lost my dad in September, it was 2 weeks after losing his oldest sister. Few weeks from one of my dogs passing, and then the toll of being a caregiver, sometimes, for me, it resulted in me and my husband deciding that we probably make better friends than being together. So it was a lot of things, but it's the catalyst for me to take the thought I had working with him or advocating for him in his last 10 months and turning it into a solution that would help not just me, others, but provide a service that I wish I could turn to. I'm a data geek. Don't even try to read all the numbers. It's there because numbers make me excited. I don't watch TV, I read books. So, and I do research. big thing on this is we're living in an aging country. If you don't know, haven't heard of the silver tsunami, read it. It's like the baby boomers, 10,000 of them turn 65 every day till 2030. Elderly admissions, readmissions, and stays are extending as people continue to be sick. Travel is expensive. Everybody isn't a remote worker. Flexibility isn't unlimited, but what we do know is that people are willing to pay for convenience. DoorDash, we deliver everything. When you go online, you can just about do any and everything. Amazon, somebody delivery. If you can delegate it, we'll pay for peace. I do. My cleaning lady is the best thing that ever happened to me. I will not eat as long as she comes to clean. I can drink water. There are also, some of us identify as caregivers. 53 million Americans also identify as so. So there's definitely a need and a gap, and I knew I wasn't alone. I always have thoughts, but then I go validate them just to make sure it ain't me and I'm not alone. Clearly, I'm not alone. The challenges that we face is physical, emotional stress. It's real. Stress manifests itself physically. You see caregivers are more prone to getting sick, and sometimes they transition before the people they're caring for because they're often neglecting themselves while prioritizing others. There are limits. There's a national healthcare shortage that isn't going to be addressed anytime soon, and I didn't find the existing options just weren't good enough. So checked on my loved one, came from all of those things in my experience. What I want to offer is wellness and advocacy service that people can go online and schedule to remove guilt, provide confirmation, connection, and compassion where it needs most. My dad lied. If you talk to him on the phone, he tell you he's fine. You look at him, I'm like, you ain't fine. So I want to be able to provide that truth, because some people don't want to burden you. I want to be able to offer video visits, somebody to go advocate and show up and stand in the gap when needed, as well as offering wellness visits using a checklist and observation guide that I developed with first responders, medical professionals, and others, just to make sure you understand what's going on. Because for me, I'd send one of my kids or somebody, they go see my dad and come back with no information. It's frustrating when you send somebody to do something for you and it's just like, you may as well not know at all. So there's a huge market opportunity with the numbers and our aging system. The senior care industry is over $600 billion. There are a lot of numbers here, but I want to start a pilot in Northwest Indiana, then branch out to Chicagoland. As you can see, the numbers are there, the people are there, and the needs there. I did a market validation survey of over 500 people to find out, is it just me, am I thinking this sounds good, or would this service actually be something that folks are looking forward to? Yes, it was. I'm working on this timer. I'm almost there. Stay with me. So here's our competitive advantage. As you can see, what I want to provide, no one else fully provides. Some people, for seniors, police checks may not be somebody they're looking forward to or want to see at their door. Home health is a service you get through insurance. Care.com does a lot of things. We focus just on seniors and their families. And Life Alert is more, those bracelets are reactive. We're seeking to be proactive and stand in the gap when people need it. As I said, I have an amazing advisory board that have helped me come up with training, the checklist, the information, and consider things that I may not have been thought of. And for the pilot, I also have the folks that I want to use for my pilot from community and different aspects, backgrounds, and information, just to make sure I'm covering the gamut of things. This is my pilot roadmap. Currently, we're here. We're securing professional services, all that good stuff, deciding on a funding path, working through this line, and hopefully I want to launch my pilot by the end of summer, early fall. And as I said before, I can't decide on the tagline. There's a QR code here with 2 questions. Think of a better one, I dare you, go ahead, but I like all these things, there's so many. So there's 2 questions, and there's also a place you can leave feedback should you choose to, if you come up with a better one or have thoughts in the event that we aren't able to connect. In here, and ooh, I didn't go with that, it's not that bad, chick. That's it, I got to the end and I didn't do too bad on my time. Thank you. And
30 seconds before.